Next, Jay Lakshmi. You want to do speaking? Yeah, you can do. Send me which card in WhatsApp. Jay Lakshmi. Next, Jay Lakshmi. You want to do speaking? Yeah, you can do. Yeah. So, Jay Lakshmi. Jay Lakshmi, when you are ready, you can start. Okay? Sorry, not Jay Lakshmi. It's Greeshma Shankaram. Yeah.
Yes, sir, we can start.
Yeah, you can start.
Good morning.
Good morning, nurse.
Let me introduce myself. I'm Greeshma, one of the community nurses working in this community health center. For the better communication, may I know your name, please?
Yeah, my name is Elizabeth, and I am the daughter of Martha. My mother, she is 80 years old.
Nice to meet you, Elizabeth. May I know the reason for your visit, please?
Yeah, I came here regarding my mother. She is here, and I want to know about her condition. I want to know more about this cholesterol. I don't know anything about it. Can you explain me? My mother is everything for me, and I want to know her condition as it is.
Sure, Elizabeth. I can explain regarding cholesterol. But before proceeding further, may I know your understanding about cholesterol, please?
Yeah. Um, I don't know anything, nurse. Think that it's zero. So you can tell me everything from the scratch.
No worries, Elizabeth. So, first of all, cholesterol is the fat-like material. It presents in the blood and most of the tissues in the body, and most of the foods like meat and dairy products containing cholesterol. But cholesterol is also an important component in the body for to uh, to work properly. And however, this cholesterol in the blood is not good for health, and it can have higher risk. And coming to the types of cholesterol, there is high density lipoproteins called HDL, and low density lipoproteins. And high density lipoproteins are good for health, and low density lipoproteins are bad cholesterol. And I think now you have an idea about cholesterol, right?
Yeah, of course, that's clear. I have some idea now about cholesterol, but doctor told something called fairly high level of cholesterol. What does he mean by that? I'm concerned that her condition could develop something worse.
Uh, yes, well, Jabet, I can understand how much you are worried about this cholesterol, and do not worry, I can explain about what is a high level of cholesterol. So before that, high density lipoproteins are helps to remove the cholesterol from the arteries, and low density lipoproteins are helps is the main source of cholesterol buildup in the arteries. This can lead to emergency situations like heart attack or stroke. And about what doctor meant by fair high level of cholesterol is, it is the elevation of cholesterol levels above 5.5 millimoles per liter in the blood. So do not worry about this. We can control by the proper dietary management. Is this clear for you?
Yeah, of course, nurse, that's absolutely clear. And what do you, okay, What do you consider about my mother's cholesterol level should be according to your idea?
Yes, Elizabeth. Your mother's cholesterol level should be below 5 millimoles per liter. And do not worry, I can suggest you some of the dietary modifications. You can go through that. It will be more beneficial for your mother's health. How does that sound?
Yeah, that is fine. That's
So, do you have any
absolutely fine.
concerns? Do you have any concerns regarding your mother's cholesterol level?
Yeah, of course, nurse. I want some advice, okay, about what my mother should do to lower her cholesterol level.
Sure, Elizabeth. First of all, I strongly recommend your mother to take healthy foods like fruits and vegetables, especially eat more fiber food. And along with this, you can avoid saturated fats, which leads to increasing of low density lipoproteins. So it is bad for everyone's health. And also, along with this, your mother can do some exercises. These are the things which helps your mother's to better health. Can your mother able to do these modifications?
Yeah, of course, nurse.
Do you have any more queries to ask me, Elizabeth?
Yeah, that's fine. I got a clear picture now. That's enough for now, nurse. Thank you very much for your valuable suggestions and guidance.
Thank you, Elizabeth. I hope I have cleared all your concerns. If you have any more concerns, you can call me or contact me. Here is my contact details. I'm glad to help you today. Thank you. Have a speedy recovery of your mother.
Thank you very much, nurse. Yeah, so that's good. You have done a good job. Right. So you can mute for now. So I'll give you some of my feedback. Right. So because you are unlimited, I will be unlimited. That's it. Fine. Greeshma Shankaram, cholesterol information. Grishma, first thing is I appreciate you for your confidence level. You're very confident. You're very confident. Of course, there is a little bit fear. I no, have no doubt regarding it. Fear must be there. Fear is positive. Fear is not negative. Fear is positive because of that fear you will be careful. If there is no fear in the body, that care will not be there. That responsibility will not be there. If you have fear that you have an exam tomorrow, you'll prepare well today. If you don't have fear, so fear is very important. Fear is a part and parcel of human nature. It is a must. Okay, right. So you can overcome that fear slowly, slowly, slowly. Fear must be there. So it presents in the blood. It presents in the blood. You said cholesterol. It presents in the blood. So it is present in the blood. You have to say it is present in the blood. It not it's it pres. You said it presents. No, it is present in the blood. That is what you wanted to say actually, and you got a little panicky there. Right. Dairy products containing cholesterol. Dairy products containing cholesterol. Dairy products contain cholesterol. Okay. Dairy products contain cholesterol. Um, cholesterol or which lead to cholesterol. Products contain material which lead to cholesterol. I have a little doubt there. Okay. Otherwise, everything is fine. Everything is fine. The next one, these cholesterol, these cholesterol, no, this cholesterol or just cholesterol, enough. These is wrong. Cholesterol is uncountable noun. You cannot use plural form. So this cholesterol. Next you said, there is low density lipoproteins. There is low density lipoproteins. Now what is this? Is a mistake, ne? Lipoproteins, plural. You can say there are, there are lipoproteins, low density lipoproteins. There are high density lipoproteins, not there is wrong. There are. Okay, there are lipoproteins, low density lipoproteins and high density lipoproteins. You can say. Next, these cholesterol. You said these cholesterol. Cholesterol is enough, or this cholesterol is enough. Not these. It's a mistake. When you say these, it's a mistake. It's this. It's just cholesterol, or this cholesterol. The next one. Ah, ah, ah. Pauses and breaks. Avoid these pauses and breaks. Unnecessary sounds. Unnecessary sounds and pauses and breaks. Avoid them as far as possible. Avoid them as far as possible. Next, lipoproteins are helps. Lipoproteins are helps. Lipoproteins help. Lipoproteins help. That's enough. R is not needed. Helps, not needed. S. Lipoprotein helps, but lipoproteins help. And lipoproteins is plural, not singular. Okay, it's plural. So you have to use S. Lipoproteins help. Then you said this can leads to. This can leads to. When can is there, S is not needed. This leads to. This leads to, correct. But when you say can or may, then no need S. This may lead to. This can lead to. Or remove may and can and say this leads to. Remember that. Okay. This lead to. The next one. You said mint. MEANT. Mint. It's not mint, it's meant. Mean, meant. Past tense, meant. Meant. Okay. Meant, not meant. Don't use the word meant. Meaning is different. Meant, no, meant. Pronunciation is meant. Next one. Avoid repetition of words or phrases or sentences. Avoid as far as possible. The next one. Modifications. You said modifications. Then you said it can. When you said modifications, they can, not it can. Modifications. You said plural. The next sentence, it can. How can it? It should be they. Modifications. You're talking about modifications. They can help you. Not it can help you. You have to follow. You have to take. You have to do some modifications. It can help. No, they can. Modifications can help you. They, not it. These are the things which helps. These are the things which helps. Things which help, not helps. Things is plural, so which help, not helps. Remember that. So you have a problem here. Helps, helps, helps. Many times you are using this word helps. Be careful with this word. Avoid a repetition. That's what I'm telling you. Avoid a repetition. Is that clear? Yeah. Now, Grishma, you can unmute now.
Yes, sir.
Yeah, you have 1 minute to 2 minutes, minimum 1 minute and maximum 2 minutes. Whatever you want to speak, you can speak.
Yes, sir. With this session, I have know that my grammatical errors, and also I need to avoid repetition. Sir, if possible, can I do another role play card?
Yeah, you can definitely do. You can definitely do. Now, what I'm asking in this session is you have used only 30, not even 30 seconds. I gave you 1 minute to 2 minutes. You tell how this session is useful for you. What did you learn? Are you happy with this session? What you gained? What was the difference between previous sessions, which you have practiced earlier, and this session you practiced with me, Simon Sir, our Grandmaster class? I want to know from your own words.
Yes, sir. Uh, before uh, before I did my speaking, I don't just I go with flow. But now I have known that what are my mistakes, and uh, also it these speaking sessions are very helpful to get more fluency while doing the speaking. And also other cons other coaching centers, they didn't told about grammatical errors and all. They just go with the phrases which they learn. But with your guidance, I have known that what are my mistakes, what are my grammatical mistakes.
Yeah.
This is very beneficial.
Okay. So now you said that they didn't told. Didn't is
Yes.
already past tense, so told is not required. They didn't tell.
Oh,
So like
okay.
that. Mistakes are there, so you can overcome those mistakes in this way. So yeah, sure. Okay, no problem. You can prepare another card, and if there is a slot, and if nobody is there, I'll definitely take. You can be there. You can always be there. Whenever nobody is there, you can take. Okay.
Okay.
Now Richard has already finished one speaking session. So Pranita Pamarti. Pranita Pamarti, you can message me if you are interested in the speaking session. Otherwise, Richard or Grishma can take another session. You can prepare. If nobody is there, those who are continuing, they will get another additional session. So if you are interested in another session, yeah, Grishma already asked me. So Grishma, you can message there. I want to do another speaking session. Yeah, you can do. I will tell in the WhatsApp or chat box. Yeah.